the ones I tried, they don't work. Let me know when you start.
Yeah, you can't be doing all that, man.
Are you ready? Alright. So I'm gonna be doing a reflex test on her patella. I'm gonna locate the ligament here. So nothing. Don't kick me if this works. She gets a 0. There's nothing happening. Okay. Range of motion of knee flexion and range of motion of knee extension on partner 1. So we want to palpate for the greater trochanter, which is where the stationary arm will be aligned with, near the head of the femur. And then down here, we're going to place the stationary arm near or aligned with the lateral epicondyle of the femur. And our axis of rotation will be at, or sorry about that, our axis of rotation will be at the lateral epicondyle of the femur, and our stationary arm will be aligned with the lateral malleolus. So we're gonna have her to flex her hip 90 degrees. So I'm bring her leg up. And after she gets 90 degrees of hip flexion, we're gonna have her to flex fully at the knee. Thank you. So again, lateral epicondyle. This is aligned with the greater trochanter, which should be about here. And this will be the lateral malleolus, which is here. All right, so she's measuring at 110 degrees, and then the average range of motion is 120 degrees of knee flexion. So you can pick it. The next one is knee extension. Average is 0 degrees of range of motion. So we're gonna have her to lock her knee. Go ahead and lock your knee. Same bony prominences that we need to fill for. So we have our lateral malleolus, greater trochanter, and then the axial rotation at the lateral epicondyle of the femur. So we're gonna go here, and she is at 0, which is where she should be. Okay. The last thing we're gonna do is a manual muscle test, testing the semimembranosus and the semitendinosus, as well as the bicep femoris. So we're gonna have partner 1 to lie prone. Can you please lay on your stomach? And since we're doing a manual muscle test, we don't have to palpate for any landmarks. We're gonna have her to bring her leg up, flexing the knee, and we're going to externally rotate her toes outward. This is testing the semi-min and semi-ten. I'm gonna place one hand proximal to the ankle, the other hand securing at the thigh to help with the knee joint. I'm going to place or apply pressure downward. Try to keep your leg stable, okay? Are you ready? And here we go. 1,000, 2,000, 3,000, 4,000, 5,000. All right. So that will be about a score of a 4, since she was able to do it on her own against gravity, which gave her an automatic score of a 3. We're gonna do the same thing for the bicep femoris, flexing the knee about 90 degrees, but this time we wanna internally rotate her foot, so where her toes are pointing medially. Same placement, one hand proximal to the ankle joint, the other hand proximal to the knee joint. And I'm gonna do the same, apply the same resistance, okay? All right, ready? Here we go. All right, and again, you can put your leg down. Again, she gets a grade of a 4. You can feel a slight little bit of release there. So that's the video for tonight. Thank you. Thanks, best friend.